Plastic surgery gone bad. Amanda?
In a world where our culture is obsessed with youth and beauty, some people revert to plastic surgery to achieve a certain look and turn back the hands of time. Guided by weekly magazine covers catering to a public thirst for perfection, some can take that quest to the extreme, and the results of too much plastic surgery can be disastrous. Highly accomplished plastic surgeons Dr. Dubrow and Dr. Nassif work with these victims to undo the ill-fated cosmetic work and attempt to fix their lives. Good morning, doctors. Thank you so much for joining us.
Good morning, Amanda.
Thanks for having us.
You have quite the job on your hands, because it seems like oftentimes now, especially in all of these magazines, some of the stars back in the day that got plastic surgery, as they age, we seem to see more and more plastic surgery gone wrong.
Yeah, you see a lot of plastic surgery gone wrong because I'll tell you, it's surgery. And plastic surgery, like all surgery, has complications associated with it. When you get too much of it or you try to get discount plastic surgery, that's when it can go horribly wrong. And that's what we're tasked to do on this show, is to try to fix plastic surgery that's gone really bad.
So what are some of the worst cases that you've seen? Is it like a specific plastic surgery that always seems to go wrong that you need to fix? Or is it just an array of problems?
Well, I mean, I'm specialized more than anything in revision rhinoplasty or nose jobs. And so we'll have patients that have had maybe 5, 6, 7 nose jobs. Actually, we have a patient on this show on the first episode. I think she had 6. But in addition, we have patients that have fillers injected either in the nose or on the sides of the face that can destroy the nose. So for the one area that I see is that, and for you, Terry,
well, we had a patient who went to Mexico to try to save money. Instead of using an anesthesiologist, they put blocks of ice on her abdomen to numb her abdomen. It worked. She didn't feel it, but it killed her entire abdominal wall. So it was a disastrous result. Okay, we saw everything.
We hear, like, with the 6 or 7 nose jobs, we hear that plastic surgery is kind of addictive. Now, in that case, was that something that it just wasn't right, or there was complications each time? Because, I mean, 7 times, that's a lot.
Well, I mean, that's a good question. Sometimes there's functional issues you're trying to keep fixing, and maybe you go to that doctor, and that doctor really isn't the right one, and you keep going back to the same doctor, versus that pursuit for perfection where there's something called body dysmorphic disorder, where they actually are seeking perfection of something that actually is not bad. But they're seeing it in the mirror when they look at it, that, oh my God, this is horrible, and I got to get this taken care of. And then they find a doctor who will operate on them. And then you actually have this vicious cycle, and then that's when we have to put an end to it.
And in your opinion, what advice do you have for people that are considering plastic surgery, but they're terrified of complications or not using the right doctor?
I think do your research, go to a board-certified plastic surgeon, but if you're really terrified, if you have a gut feeling that something could go wrong, maybe it's not the right thing for you to do. Because plastic surgery, like I said before, is surgery and it can go wrong. So you have to be very careful about it.
And when is too much too much?
Well, that's a great question. I mean, first of all, the goal with it is you want to look natural and rejuvenated and refreshed. You don't want to look different. So that right there would be too much when you see something that looks different. But the biggest thing is you have to combine the medical and the psychological aspects to make sure that it all works in unison together so that everything is done the right way and it doesn't cause any problems. We don't want to hurt the patient. Yeah. Number one concern for us.
Yeah, the enemy of good is better. And if you look good, you don't need plastic surgery.
All right, you heard it here first. If you look good, you don't need plastic surgery. Doctors, thank you so much for your time.
Thank you so much, Amanda.
And don't go anywhere. The Morning Blend will be back before you know it.